Welcome everyone. My name is Dr. Njiru Cynthia Lisa. I'm the program's assistant, Kenya Healthcare Federation. We want to thank you for joining in and registering for this webinar. I'll hand it over to Faith.
Thank you, everybody, for all who have joined. We're just have a pleasure of actually hosting you and just trying to knowledge transfer in issues that we think are pertinent in building systems. And when we talk about systems, we're talking about our healthcare system where medical equipment is pertinent human resource for health technology, infrastructure, and so on and so forth to make an enabling environment to provide care in a safe and competent way to the citizens that we serve. So thank you. Next slide. I have my team here. You'll be hearing from Madenge and Omar, who are just experts in the finance domain. And it's an area where we feel that there are gaps in terms of understanding building a business in healthcare and sustaining it and so on. So I think we're going to get a lot of nuggets from our team members here in terms of running a business that is sustainable, but that also serving the greater good of what we're trying to do in transforming healthcare in Kenya, in sub-Saharan Africa. Next slide, please. Okay. So once again, when we talk about the World Bank, we are World Bank Group, we're serving over 100 countries. We provide investment advice and resource mobilization. The team here, we are more of advisory in terms of assisting healthcare organizations to actually strengthen what they're doing, their systems, and so on and so forth, from a quality perspective, from a financial perspective. IFC serves, go ahead. No, that's fine. IFC serves as more of an entity of the World Bank, but particularly with the private sector as well, whereas the World Bank serves more in the public sector domain. Let's talk about the AMF program, which is why we're here. And so AMF is the Africa Medical Equipment Facility project that was launched in 2 countries, currently operating in Kenya and Cote d'Ivoire. And it stemmed from when COVID actually through COVID, actually, in terms of trying to be a response system to actually making sure healthcare organizations are procuring the correct medical equipment with the support of genuine original equipment manufacturers to make sure that they're able to serve in the best way possible. And we're looking to scale that up in Africa, and that's working. We've partnered with banks. In Kenya, it's a cooperative bank where we are de-risking the bank to be able to provide financial resources to healthcare organizations, particularly in small, medium enterprises. So AMF is, we want to increase access and availability of medical equipment and associated services in 9 countries. We're in 2 right now, and we're scaling as we go. We're in Ivory Coast and Kenya right now. We're trying to provide a financial solution because healthcare has always been looked at as a risk. And we're trying to actually emphasize that actually healthcare is not a risk, and we have financial institutions and entrepreneurs who are actually committed to making it work. So we want to allow local partner banks to lend to private healthcare SMEs and facilitate access to up to 300 million US dollars of loans and so on and so forth. And basically we're building partnerships with health with financial institutions to be able to provide that service. Next slide. Next slide, please. So what you see here on this slide is that we work in different ways as advisory and so on and so forth. We're working with banks and so on. So we're providing trainings as IFC to our banks to understand healthcare institutions, because we know there's a knowledge gap in how do they work and so on and so forth. But then also to provide guidance to health HSMEs to say, how do you present to financial institutions so that there's appetite in that relationship and so on and so forth, and trying to build that trusting relationship and so on. Right now, we have partnered with 10 OEMs. The OEMs are there. There was Mindray, go back. Mindray, One4, GE, Philips, Karl Strauss, Getinge, Biomerio, and Siemens. And that's who we're working with right now as equipment manufacturers to be able to support HSMEs in our local entities. Keep on going. There's eligibility criteria, who can benefit from this product. It's private hospitals, clinics, laboratories, imaging centers operating since at least 3 years. So not startup organizations, but organizations that have actually shown that they are actually lucrative in their business, so to speak. They have to have a certain level of income so that the banks can actually accredit them as being eligible and so on and so forth. Their loan amounts between 500,000 Kenya shillings to 200 million shillings, tenure up to 5 years. There's a grace period and a moratorium of 3 to 6 months. And then the funds are to use to purchase medical equipment, and then the supportive services that comes with that. Next slide. One of the things as we're doing purchasing or procurement of equipment is to actually offer advisory services from a quality perspective and then from a financial perspective, where we are able, and today you'll be hearing more from our financial team about the financial perspective, because we're talking about return on investment, effective budgeting for medical equipment, and then the overall key pillars is to be a successful healthcare organization. So our team between Madenge and Omar will just deep dive into that. As I transition is to actually mention that we offer HSME training. So training to our small, medium enterprise leaders, be it procurement advisors, be it administrators, be it CEOs, and so on and so forth. And the next offering that we have is a training in Nakuru at the Sarova Woodlands Hotel, where we'll be offering a 2-day training where we're talking about strategic procurement, and we like to engage or offer assistance in any way that we can to your key entities in your institutions to build successful systems within your organizations as well. We also have online modules that are open for you to share with your team members that will link to HSME training as well. And we encourage you to actually sensitize your teams to that sort of knowledge and so on and so forth. Next slide. So I'll open it up to our team members, Omar and Madenge. If you can move into the nuts and bolts of budgeting, return on investment, and strategically planning on strengthening healthcare systems through procurement of medical equipment. Thank you.
Thank you so much, Faye. And hello, everybody. It's a pleasure to be here. My name is Omar. I've been working with IFC over the past 2 years, and I've been a big part of my focus has been on this AMF project, and particularly on the financial management component. So the reason we have this component in the AMF program is, as you know, financial planning and management is a big part of your equipment purchase decision. And particularly when it comes to financial planning, here what we want to present today is the importance of having a budget. So to start off, I mean, to keep it simple, what is a budget? So a budget is basically a plan. Usually it's a short-term plan that covers maybe 1 year, where you project or you predict the income, expenditures, and the cash coming in and going out of your business for the given period. This helps you to set more short-term targets, to basically set your short-term targets, to monitor your performance on a more short-term basis. So usually, like I said, your budget might cover 1 year, and you're able to usually break that down into month-by-month targets and predictions. So that allows you to be able to monitor your performance on a monthly basis to see if what's actually happening is according to the plan that you originally set. So when making a medical equipment purchase, it's very important to factor in all of the considerations that might impact your company's budget. So that has to do with the payment, so like your payment plan for the medical equipment, the expected revenue that the equipment is going to generate. If you're taking a loan, the loan repayments that you have to make and the interest that you have to pay, and so forth. So all of these considerations that are related to your purchasing decisions, it's important to factor those in to your annual budget to get a holistic picture of how this piece of equipment is going to fit in my business, and how from a financial perspective, am I able to cover everything that's needed for that, everything that's needed in terms of the costs and so forth to operate this piece of equipment. So moving on, as I mentioned, so we factor in all of the considerations related to purchasing a piece of equipment into your company's budget. So as a starting point, before we even prepare a budget for your company, or if you already have one, but before you even factor in the purchase of medical equipment, you need to collect some important information. Now, the information that we have here on the screen is basically the type of information that you get from developing like a business case for the piece of equipment that you're going to purchase. So first, you actually have to do kind of a feasibility study to see if there's a need for this service, or if you're replacing an existing business line, or let's say you're replacing one imaging machine with another, you need to have a clearly articulated need to do so. And then you need to start estimating like the demand for this type of service to see how much volume or traffic this might generate for your business. Now, the list that I'm saying here, it's important to mention that a lot of these items you're going to include, they're actually the assumptions that you're going to use to develop a budget. And we're going to clarify a lot of this as we go. But basically, in order to prepare like a budget or a plan, you need to base it on a number of assumptions. So assumptions like, for example, a prediction of how many people might use that service. So usually that prediction is based on what the research or what type of information you gathered when you were doing your business case for this piece of equipment. So based on that type of information, you are able to predict potentially the demand and how many people might need your services. You're going to look at obviously your competition, which will help you factor in, which will help you predict your demand. So not just how many people need this service, but how many competitors actually offer this service. So you might get a portion of that market, not the whole market. By what extent you expect this to grow in the coming years? Potentially, sometimes when you introduce new service lines into your business, that it might actually help increase the traffic to existing business lines. So when you introduce radiology, maybe your lab or your pharmacy or your outpatient clinics might increase because people will see you more as like a more integrated facility or a facility that offers more services. And then also it's important to consider how your services are going to be paid for. In the case of Kenya, what we've seen in the past is the vast majority is covered by NHIF. And then there are some more qualitative, let's say, considerations like, do I have the skills needed to operate this machinery? So if not, you're going to need to hire somebody who would operate like a technician or a radiologist or something like that, who would be responsible for this kind of service. And that would mean that you're going to have to pay for their services. So that's additional costs. So the salaries will increase. So basically, in short, before you start preparing your budget, you usually prepare your business case for the piece of equipment that you want to purchase. And from that, you're able to derive a lot of the information, which you combine with existing information about your business to develop your budget, which is a short-term plan for the upcoming year to be able to monitor on, let's say, a monthly or a quarterly basis, how your plan compares to what's actually happening on the ground. Now, to make this a bit more clear, I'm going to pull in my colleague Matinge, who will walk you through the different steps involved in preparing a budget.
Good evening, everyone, and thanks for creating time to join us in this webinar. We are glad to share our knowledge with you. My name is Rokwaro Malenge, and thanks Faith and Lisa and Omar for taking us through the initial presentations. So in the next phase, then we are going to look at some various components, and we will start with the steps in budgeting for medical equipment. Let me just come in here and say that a budget for an organization is not only for medical equipment. Is that mostly you will prepare a budget that encompasses the entire organization, and the budget probably for the organization will have three components. One is the operational budget, which is your income and expenditure, as Omar had mentioned. The second one is your balance sheet, which encompasses your CapEx expenditure, and that's where your medical equipment falls into. And then thirdly, that's your cash flow projections, because that tells you how much cash you require into your incoming financial year. So as you start your budgeting process, and having gathered the information that Omar talked about earlier in the previous slide, then the first one is you need to collect the critical information that you need to put up a budget. And in this case, this is what we call assumptions and targets. And it is important that when you're doing this, that you involve the user department in case of equipment. For example, if you are replacing, say, a CT scan or you're buying a new one, then it is important that you involve the decision makers on the ground, because they're the ones who will generate the business. One of the challenges that I have seen in my experience in the healthcare industry is where there is a top-bottom approach to budgeting, and then when it is cascaded down to the user departments, then you find that people don't own the budget, and then they don't work to achieve that. So in case of CapEx planning, then the key thing that you need to collect first is having established that you have got the need for the services that you want to introduce, or if you are replacing an existing equipment, is the cost of purchasing the equipment. If you are planning to put in an MRI, then you'll get quotations from various suppliers, and then you'll compare, of course, using also other technical requirements and see what you want to go with. Sometimes you might not go with the lowest in terms of cost based on what you require. Then, of course, the cost of infrastructure associated with the equipment, be it the room, the IT requirements, that is hardware, software, and connectivity, and of course, things like furniture. Then you need to estimate the number of patients. If you are replacing equipment, then this is easy because you have got historical data. But then even where you are introducing a new service, one of the areas to start in terms of estimating patient numbers is your internal data. For example, if you're buying an ultrasound machine, probably you know from your HMIS or your medical records, how many ultrasound referrals are you making out in a day? And then that should be able to tell you, this is the number of patients I'm gonna get per day. You'll multiply that by the number of days, working days in your month and the year, and like that. Then, of course, you need to put in the number of operating hours per day. And why is that important? That helps you in knowing how to staff your facility. Secondly, you need to estimate or gather the price per procedure. That is, if you're introducing new equipment, which is readily available in the market, if you benchmark with the competitors. Then you need to get your direct consumables per procedure. Some of this, it's easy. We know if it's ultrasound gel, if it's Cotrans for CT, if it's films, we know what it can be used per procedure. Then your HR cost, that's your, your technician, your biomed, your radiographer, and of course, the person may be reporting. Then you need, of course, put in your operating costs, being power, insurance, maintenance cost, other staff costs, training, etc. Then you need to estimate your source of capital for CapEx. This is whether you are in existing business or it's a new service that you're introducing. And why that is important, one, it will be able to tell you, for example, if you're going to use your own cash flows, how will that strain your working capital? If you're going to borrow, then you need to take care of things like the interest rate and how then that will also sustain your cash flows. Then, of course, estimate the useful life of your medical equipment. That is important in terms of estimating the depreciation rates and also calculating your return on investment. If you're buying equipment from abroad, then you need to factor in exchange rates. For example, you might get a payment plan from a distributor or a manufacturer, and then you're paying in dollars. So you need to estimate your exchange rates over the repayment period. And then, of course, the depreciation rates, which tells you how long you're gonna be able to use the equipment. Once you have your assumptions, then the next thing will be to do a budget preparation. And here is that you would use a template similar to what we saw in the first slide that Omar presented. Of course, it will be a bit more detailed than that because you need to put in your activity. That is, a number of days in a year, estimated patient numbers, price per procedure. If that is difficult, then you can use average price per, per patient visit. Then you'll come in, do your COGS estimation, and then once you do that, then you come and do, you'll get your gross margin. After below there, then you'll be able to put in your expenses. Then you'll be able to get your profit or loss during that particular financial year. Then the second one is, of course, the balance sheet. And why this is important is that, for example, if you're sourcing for capital from lenders or equity partners, is that they will always ask for these documents. So it's always good to be future ready. Don't do something only for today, but look for, what's going to happen if somebody tells you, yes, we have got these numbers for this year, but show us what you're going to do, how your balance sheet is going to look like next year. It is important that when you're at your budgeting phase, because remember, a budget is a short-term forecast. Usually, it's a one-year operating plan. But it is important, especially where you're buying medical equipment that is revenue generating, to forecast the performance for the next 5 years. And what that tells you is, number one, is that within the next 5 years, will you have recovered your investment? And what kind of return will you be able to get? It helps you strategize in terms of business development. Who are you going to reach out? Is it doctors, referring doctors? Is it standalone clinics who don't have these facilities? And you're able to have at least a medium view of and strategy of where your business is heading. Once this is done, even if you are a non-manager of a healthcare business, I always encourage heads of business to have a review, a maker checker, and authorizer mechanism. For example, if you have a finance person, they will work with the other departments to put up the budget. Then probably the senior leadership in the organization will go through the budget, having set your targets in step one. Then you'll see, are we being over-ambitious? Are we being under-ambitious? You might want to go back and see whether the targets are realistic or unrealistic. Make some changes to your budget. And then once that is done, you approve the budget. And that becomes the Bible that you will operate with. And that helps you to track the performance of your CapEx and your business going forward. Next slide, Lisa. All right. Once you have your budget and it is in place, it is important that you measure your actual performance against the budget. Now, for replacement CapEx, this is easy because what you do is you'll have your prior year numbers. For example, we are in 2024. So if you're using a budget for 2024, then you'll be comparing with the performance of year 2023 vis-a-vis the budget for vis-a-vis the actual performance. So if you want to get clarity on where your business is headed, I always encourage that you use 3 periods simultaneously when you are reporting on a monthly basis. And it is very important, let me say, that you at least have management accounts or some sort of management reporting at the end of every month, because I have seen people who do quarterly reporting, but unfortunately, when you're doing quarterly reporting, you are trying to solve or fix issues that arose 3 months ago. So you would, on the first section, report monthly. That, for example, we are in March. So if you're reporting for the month of March, then what you would do is you will have March 23 actual, March 24 actual, and the March budget. Then you will go and compare quarter. If your year starts in January, you will compare Q1 2023 2023 with Q1 2024, and then budget for Q1 the same year. Then when you get to half year, you do the same thing, and then you always do on a year-to-date basis because you want to see the performance. For example, between January and September 2023, how was your performance compared to January to September 2024, and again compared to the budget. For new capex, you will not have a comparison for prior year because you didn't have the service. So mostly you'll be comparing budget and actual, and it will follow the same rationale: monthly, quarterly, and year to date until you get to the year. One other aspect that I would highly encourage that HSMEs and even any other business do is that review your budget on a quarterly, half year, and 9-month basis. What this you're able to see is whether you are underperforming compared to your budget, and you need to revise your numbers so as to look at your cost, your interest payments, your cash flows. And if you find, for example, that your actual performance is 95% to 99% of budget, that means you're meeting your budget. So there's no need to reforecast. So the budget becomes the forecast. But where you are below 95% or above 105%, then you need to refocus because that means that there is something that missed, or you're doing quite well, and then you need to revise your targets because remember, the higher the revenue grows, the higher the cost grow. Other things could happen, like we have seen in the last 2 years or so. The Kenyan shilling versus the hard currencies has been behaving like a ping ball. So you might want to go and look into some of the other inputs that are really not based on your revenue performance, but they impact your bottom line. Next. All right. So here is just a snapshot of what I was talking about. So, for example, and you will see, some certain things that are marked in red. So here is just one section of the P&L that we are trying to compare, and I have used March 2024 for demonstration purposes. So for Clinic A, in last year, March, they had done total revenue of 5 million Kenya shillings. This year, they have done 8.6 million. And the budget was 8.175. You can see they're doing very well because they are 55% above prior year, and they're already 5% above their budget. However, if you can note, because the colors are very interesting, anything that is depicted in red, you can see it's minus. That means it is behind all the comparisons. Anything that is marked in green is doing very well. So in this clinic, you can see the consultation revenue is 8% above prior year and 6% above budget. Problem number one to me, from a budgeting perspective, and that's why I was talking about reforecasting, is that this clinic had a budget. A lab, and this is by design, it's not by default, and note, because I would want somebody to answer me what they think the problem is here. Laboratory below last year, below budget. We know lab is a consumer of consultation referrals. So the question is, what is happening here? Look at the patient numbers up there. 15% against prior year, but lab revenue is below, 4% behind budget. Pharmacy, flat, below budget. So again, it's red. Then here we come to now, this clinic was introducing a new service, and this is where, for the imaging service, they do not have a comparison against prior year. But you can see, again, they had budgeted to do 2.1 million in March of 2024, but they have done 3 million. So again, were the assumptions right, or did they miss out something? Then you come and of course you'll compare your doctor's fees, and then you will see what is happening. One thing I wanted to bring to your attention here is if you look lab consumables, and this happens a lot, is the revenue dropped, but the cost of consumables went on. So if you see something like this, as the head of finance, as the CEO or the hospital admin, or even the head of the lab department, you need to ask yourself questions. Why is my cost higher than what the revenue?
I think you're bringing a good point that we never talk about, and it's the silent conversation, because when does the CEO get this information? A lot of the time it's too late, right? And so
Yeah.
we have 85 people here on this call, and I think the points that you're raising in terms of the day-to-day runnings of a business in healthcare, and thinking about it's just not the lab, it's the consumables, and everything goes to that. We haven't even talked about the human resources that have to deal with all of that, and then to provide a service. So it would be interesting to just hear from our participants what their thoughts are in what Madenge has just driven, because that's actually a live conversation and it happens every day.
Okay, Faith, I'm gonna make a special request because I'm almost done. If we can pack that question and then I go through the next slide so that we can have ample time for the discussion. I'll be done with the next slide in the next 3 minutes. Is that okay?
Absolutely.
Yeah. So please note that. I mean, you can look, and if you look keenly at that data, is that when you go to the cost, you can see some mismatches, and then that tells you that there could be a problem. Why is financial analysis important? It gives you visibility on the performance, whether performance is achieving targets. Do you need to review your revenue generation strategies, cost control? Do you need to make interventions in a timely manner? And then it, of course, improves your accuracy for future forecasting. Again, remember, financial analysis not only helps you to track performance against budget, but also helps management to match growth with cost versus revenue growth. Identify revenue leakages, an example of the lab there, and identify any other operational issues, and that is a topic for another day. There are areas, especially like imaging and lab, that where you find that your utilization is low, you need to ask your question. And as a finance person, I have asked my quality heads and operation heads, are you guys sending sick people home? Am I liable for a lawsuit because somebody was not diagnosed properly? Next. Yeah, I think to wrap up, again, you have invested, and then having invested is you always expect a return on your investment. Two financial ratios that you can we basically use in the financial world to measure how good the investment we have made is one ROI. There are people who use the return on capital employed. Mostly they'll drive you to the same outcome. And then the other one is your payback period. So ROI tells you within the useful life of this investment, what is your return? And you will find when you calculate the ROI for the first year, the return might be low because, especially where it's a new service, that means you're starting to generate the business, the revenue and the patient flow will be low in the first month, then you ramp up, but you will find probably by the third or the fifth year, depending on your cutoff, then you find you'll have made a return of maybe 100%. If you have made a return of 200%, excellent. So for ROI, the higher the return, the better. So here, this is the formula for calculating the ROI. So you take your cost of your net profit for the period. And remember, as I said, if the equipment is only used for 1 year, then you measure for 1 year. But if the equipment is used for 5 years or 3 years, then you need to do what we call annualized and take the total revenue for those 3 years and then total net profit for those 3 years, and then you'll divide by your cost of investment. And remember your cost of investment here, for example, if it's an MRI, it's not only the cost of buying the equipment. You need to put in the total cost of ownership, which will include preparing the room. If you have got an annual maintenance cost, you need to put in that. If you trained staff, you need to put in that. If you put in insurance, you need to put in that, and then you divide by that, because that cost is going directly to the cost of acquiring and maintaining the equipment. In order to optimize your ROI, it's very important to optimize cost. Remember, I didn't say reduce. I said optimize. Make sure that your revenue, your cost match your revenues, because again, if you do cost reduction, and most of us have seen it, it ends up in compromised care, and then that can cause even more financial issues where you end up with PI cases. Secondly, and please note, because this is mostly not talked about when people are buying medical equipment, especially specialized medical equipment. Straight away, I will tell you without contradiction, if you're buying a CT scan, if you're buying a CM, if you're buying an MRI, it's almost 100% sure, if you have got the right documentation, that you will not pay import VAT, which means your cost of investment will be higher. Will be lower, not higher. Look out for capital deductions. When you're buying new equipment, and if you're putting a building and putting in equipment, you are allowed 100% capital deduction over the time before you pay your taxes. Other ratios that you can use to just see whether your ROI is going on well is your gross profit margin, net profit margin. Those two should always be on the higher side. The higher they are, the better. Cost to revenue ratio, this one, the lower it is, the better. As we said, the other one is payback period, and the payback period, we just look at from your profits, how long is it going to take for you to recover the cost of that investment? And I will stop that and open it up for discussion. Faith, Omar, or Charity, if you have got any additional inputs, you're welcome.
Does anybody here have any experience preparing a budget for your organization or a business case for equipment purchase, and Are there any challenges you faced when doing so?
I just wanted to just highlight two cases. I was on mute and I was talking to myself, but somebody just asked, lab services could be underutilized, could lead to inventory loss via expiry. For me, in my experience, lab is the most overutilized sort of department in any healthcare institution. But then I beg to be sort of corrected. Could it be that this lab is having competitors who are undercutting them? So those are the two things that came in. Those are two comments that came in, and I was just hoping that we could answer the comments that are coming in. And then the third one was, hello, thanks for the discussion thus far. Suggest incorporating investment ratios, payback IRR, and ROIC. That's already a CEO. I know from that from that communication. But so those are three questions that have come in that if we're able to address them, are we able to? And then Martin was good enough to put our online courses that we would love you to actually share with your teams and so on, in terms of just empowering them with knowledge and so on and so forth. So over to you, Madenge and Omar.
Okay, I think I've seen the question from Alim, and Alim, thanks for joining. Yeah, so we will. I think we talked about our payback period in the subsequent seminars. Will include more issues, and because I know they are helpful, like the internal rate of return. Then I saw somebody else ask what is the cost of loan. I think the cost of loan depends on your discussions with your bank. What I have found is number one, it depends on how the loan is structured. You will find, for example, under certain arrangements, say like AMEF, you will find maybe the loan rate could be favorable, or you'll find maybe the rate of your bank is favorable, depends on the relationship, the bank relationships. But remember, the cost of loan for me, I always say, go beyond the interest rate. You may find that you want to buy an equipment of $1 million, okay? But then Bank A is telling you, we need 10%, no collateral, and the interest rate is 11%, okay? Bank B is telling you, for us, we'll give you 10%, we'll need collateral, and we'll need 100, we'll give you maybe 100% loan, no deposit. Now, the things that you need to ask yourself about, because the cost of of putting up this collateral can be very high. For example, if it's putting up land, you will need the cost of paying legal fees. You'll need the cost of putting a caveat on the land so that the land is co-jointly owned by you and the bank. You will need valuation for this land, and all this comes at your cost. It doesn't come at that cost. So it's always good that in all the cash outflows that will go for you in acquiring a loan. And then once you do that, and that's why cash flow budgeting is key, then you might decide, no, I would rather go with the financial institution that is giving me a slightly higher interest rate, but lower repayments per month, comparing to a guy who is giving me a lesser repayment period. I put in a collateral, and then still I'm gonna end up paying high, high monthly outflows of the loan. So those are the things that you need.
And if you don't mind me just jumping in, cheap is expensive, and having actually been an administrator in a healthcare institution where I bought affordable sort of equipment from, say, India or China and so on, but I didn't have the ongoing support. I lost because I didn't have anyone. I had to dispose of the equipment, and I needed to purchase another one. So when they see IFC as sort of partnering with credible institutions, the Philips and GE, everybody says it's expensive, but they walk you through that journey. Training, ongoing support, and all of these things that we don't think about, because when we are building institutions, we're trying to do the first thing that can work. And that's actually not the approach. And this is where we're talking about strategic procurement. And are you financially credible and apt to do that? But then are we linking you up with the right people who you can trust to take you through your journey? And it's not just a 1-year journey. It's like if you're buying a piece of equipment, it's through a certain period of time that can help you also get return on investment within the services that you're trying to provide. Over to you, Madenge.
Yeah, that's right, and that is key important factor, and that ties back to what you were talking about, feasibility study. I would for sure, without mentioning names, I will tell you right now I've got a HSME that I sympathize with the owner, that they bought a city for probably 30% lesser than what the leading brands would have sold to them. And as most of us, who have been on that journey, especially in imaging, we know that tube is the most expensive thing in that equipment when it comes to replacement. And unfortunately, it is the one that fails frequently. Unfortunately, when they followed up with the person who sold the equipment to them, the person was not responding. They were not saying when it will be available. And, 3 years down the line, an equipment worth, close to 40 million Kenya shillings is lying idle. He is paying a loan, but he doesn't have revenue to pay off the loan. So he's going back to the pocket through other services to finance a loan that actually the equipment should be serviced. And that's why from the feasibility study, we are not biasing by European, we're not biasing by US, we're not biasing by India or China. It's your decision to make based on feasibility study. But the biggest question is, what is the maintenance support available for that piece of equipment locally, without you having to talk to a guy who probably does not even understand your language? The other question was on somebody I asked, what could have been the problem with the lab, that the revenue is lower, but the cost is growing at a higher rate. I'll give you 2 examples. Number one is that there could be a problem in your clinical pathways, in that guys are not following the right procedures, and they're not referring people who should be referred. I have come across, medical legal cases that arose because somebody was not sent to the lab. They went home, they collapsed and died. Yep. So financial data can actually help you diagnose clinical challenges. Secondly, another example. The last time I was CEO in my own organization, I had a salesman from a standalone imaging center somewhere camping at doing business development inside my hospital for procedures that I was providing. And of course, all of us know what was happening there. And it used to happen that actually my city had a downtime of about 40%, which didn't make sense. Yeah. I was being given a story by, an industry colleague of a public hospital where somebody went and removed a part in a CT scan so that, they could be referred. So you need to take to look into those issues. When somebody tells you the city is down, you need now, and it happens frequently, you fix it, it's not working, please get the equipment manufacturer or the agent to come and say, what is the problem here? Is it the equipment itself, or is it issues from the inside? Then secondly, it could also be outright theft, and based on how you manage your risk, how you mitigate your risk, the procedures that you've done, then you should be able to arrest, such issues early. But then again, timely analysis, timely preparation of financial information helps you fix a lot of things. In healthcare, just like in any other business, financial information can tell you a lot of things that you might not be able to get, from your critical incidents reports, your monthly clinic reports from your manager. So give it importance, try, and as the partnership goes, as Faith said, for those who are already in the AMF partnership, we do come in, offer this advice and help you strengthen your organization for sustainability in the future.
I think we are at the top of the hour and we're actually on time. Looking at the questions there, Mohammed, Hamila, we are here as advisory. So once again, my colleagues are running hospitals, have been in the finance world. I'm clinical in terms of running hospitals as well. So we're here to offer advisory services in the best way we can possible. So I put my email on the chat, so that if there's any sort of request that we can address them sort of one-to-one. So we're here for you. So please, when we talk about this, we've been talking about infrastructure, financing, human capital, medical equipment, procurement, technology, partnerships, and then most of all, systems and processes. Because if we don't have systems and processes in place, we're not going anywhere. And we're trying to build systems that work. And this is where we talk about quality, but we don't talk about quality in a more succinct way. It's about the people, it's about the infrastructure, where are they going? It's about engaging the people who are coming into your institution, and then making sure that we have the right equipment and people who can actually operate the equipment and are trained and are knowledgeable to do that. Omar, please.
Sorry, apologies. I accidentally pressed the raise hand button. That was a mistake.
No, that's fine. So we will share the presentations that have been through the Kenya Healthcare Federation. So we're thankful for that. We'll put emails so that we can be contacted. And once again, what we were talking about return on investment, and we always say that healthcare is a sort of a social good. It's a social good, but then if you're not as a business benefiting to give back to the people and the people you're serving, then it's so we want to do good, but then we need to be strategic in how we're doing good, and want to optimize as Mathenge said, optimize cost and so on, and my always is cheap is expensive. So we have to be very strategic in the decisions we're making as organizations, to make sure we're optimizing on cost and making sure we're serving who we want to serve effectively. So I'll leave it to somebody has a hand up. Charity, I believe.
Yes. Thank you very much, Faith. I'm just wondering, Mathenge, the question about the cost of credit was about how much is this cost of credit or this opportunity for medical equipment funding? I'm wondering, financing. I'm wondering if that was the question, and if so, how would you address it? I see someone asking as well if we can work, or if we can support run hospitals, not necessarily buying equipment. Maybe you also want to address that as we come to a close.
I think I'll take the first one, Charity. Thanks. So basically, the cost of the specific facility is a discussion with our financial partners. So I wouldn't want to speak on their behalf. But what I can say is that the last disbursement that I have seen, it has been slightly lower than the market rate. It is not concessional, but they are able to have a discussion, and basically due to the partnership also with the with us. Because remember that you're not being asked for any security or collateral for this equipment, and it's financed between 90 and 95%. But they are also able to give you a slight reduction on the interest rate. Maybe probably you'll find maybe somebody offering 26% or 24% or 23%, then they could be able to offer you 20%. But if somebody is interested, please reach out to the email that Faith has shared, or also reach out to KHF, and then we can have this discussion together. We can. Currently, we are working with COP, but we're also working to bring on board other financial institutions, so we can initiate that discussion. So, Charity, let me say, if somebody is interested to know the specifics about the cost of loan for this MF-backed facility, then let's get in touch with COP and introduce them.
Yeah, we can link them up directly.
Yeah, and I also think Faith, Charity had answered the I think the comment to who was asking about whether we can support operations, and I think because this would be a specific request, largely beyond African medical equipment facility, then please reach out to Faith, reach out to Charity. Then that is a discussion outside this.
Thanks for that. Yeah.
Yep.
So I think we've reached where we're supposed to be. It's 4:05, 6. I'm in UK, so it's 6:06. We are just very thankful for the participation that you've had. There's a feedback form that we're asking for you to fill before you drop off, just to know if this sort of engagement was relevant and if there's anything else that we need to do to strengthen it at all. And I believe Martin has already sent that feedback form. I'm thankful for that. Madenge, am I missing anything? Somebody, yeah. Rukwaro, your hand is up.
Oh, mine, sorry. No.
And then if there's any other questions, if anybody wants to just bring them up, we're very willing to, we're always very excited to engage. And so if there's any questions before we drop off, if we can have the online sort of feedback session, if we can have you in Nakuru in the next couple of weeks, we'd be very, very excited to have you or your team members. And then there's the OLC training that we're asking you to feed to your staff members. So it's not just left to the C-suite, but it's bringing it down to people who actually are doing the work. And that's very important to us. So we're thankful for that. So now I'm going to take it back to the KHF team. Because I think from IFC and so on, we have done our part and we are very, very thankful for your participation.
Thank you.
As we are receiving responses from the survey, perhaps we could just give them an extra 3 minutes to see what their feedback is. What was your overall experience? Was the content relevant? Was the presentation how would you rate the presentation quality, the speaker's performance, interaction and engagement, technical quality, the duration of the webinar? Did you find it too long, too short, or just right? What about the more on the learning outcomes? We achieved the learning outcomes that were set for this webinar, and any suggestions for improvement. Continue filling in. I can be able to see from my end that we're receiving responses. Thank you so much for joining in. And as my colleague Faith has said, we are having the AMEF Nakuru. We were calling it AMEF Rift Valley because you're not only targeting Nakuru, we are targeting Nakuru, Nanyuki, Kericho, and basically in the environs. We'll be having it on the 25th and the 26th of this month at Sarova Woodlands Hotel. If you can, just come. It will be more of a deep dive on medical equipment procurement, from the sourcing and tendering all the way to the budgeting and actual procurement. We'll be able to also give more information on the co-op bank loans. We'll also have present the original equipment manufacturers that are in the consortium for the AMEF program. So if this is something that interests you, we are open to having you at Sarova on the 25th and 26th. As I'm receiving more responses, thank you so much for joining in. My name is Lisa. I work as the programs assistant at Kenya Healthcare Federation. It's a pleasure to host you and have you for our webinar today. Thank you so much, and have a lovely evening.